Live from the Carl Chevrolet Studios in West Des Moines, this is Iowa Live.
Welcome back to Iowa Live, everybody. Well, the United Health Foundation has just released the 2025 America's Health Rankings for Seniors. And to talk all about this and what it means is Dr. Ravi Johar, Chief Medical Officer at United Healthcare of Iowa. Hello, Dr. Ravi. How are you today?
Hi, Louis. Great to be with you. Yeah, fantastic.
Great to have you here. So tell us about this America's Health Rankings 2025 Senior Report. What's this all about?
So America's Health Ranking is a report that's been put out by the United Health Foundation for over the last 30 years, looking at just the overall health of America's population, looking at everything that affects health, from not only do you get your medications, do you get into the doctor, but do you have clean water, do you have clean air, things of that sort. And for the last 13 years, they've focused on seniors because seniors, we know, have special needs, and so focusing on their health. So for this, the 13th edition of this, and it actually showed some pretty promising things. For the first time since before the pandemic, our early death rate, that the number of seniors that are dying before we expect them to, has actually gone down. So that's fantastic from that. The number of geriatric clinicians, people who specialize in just taking care of our elderly population, has increased. And access to high-speed internet has actually increased nationwide, which is great because that's really important for things like telemedicine, as well as being involved socially in interactions with things. So it's been really good from that standpoint.
I was going to ask you about the high-speed internet and why that was so important, but that totally makes a lot of sense. Now, you just gave an overall view of what happened across America, but how did Iowa specifically rank, and how did we do?
Iowa did actually pretty well. They ranked number 25, so right in the middle. So they did well from that standpoint. And there are some things that Iowa did very, very well, and also some areas that of that could look at a little bit closer. They actually ranked number 1 in the country for the number of seniors that avoided care due to cost. So that's fantastic. They were in the top 5 as far as drug deaths. Now, when we talk about drug deaths in seniors, it's not just illicit drug use, which is unfortunate, but also drug deaths due to changes as you get older. Your metabolism changes and you may not be able to take the same doses of medications. There's also a lot more medications that seniors are on, so there's a lot of drug interactions. Unfortunately, and Iowa actually did very, very well with that. So that's fantastic from that standpoint. They also did really well with the unpaid elder care. So the folks that are taking care of our elderly are actually getting paid for it, which is also very good. Now, some areas where we can improve. Firearm deaths went up 41%.
Really?
So that's a real issue. Yeah, and I saw that the number of dedicated healthcare providers is one of the lowest in the country. They're 43rd. And as far as geriatricians, people that we just talked about that specialize in care of adults, they're 43rd in the country there. So there are some areas there that I think could use some increased looking at.
Yeah, so those would be some of the challenges that you're talking about after seeing that report. Are there any other challenges that you see on the Iowa frontier right now?
Well, the biggest thing, I think, was the firearm deaths. That was a concern, and the number of geriatricians.
Yeah, firearm deaths, that kind of surprised me. Did it surprise you when you saw that?
It did. It did. It's surprising. I know there's a lot of hunting and getting outdoors, so maybe that's part of it, but I don't know what else could be contributing to it. And that's the beauty about this report, is that it gives us a lot of information, and we want to do is get that information into the hands of our lawmakers and our politicians and decision makers so they can look at it and try to see what makes sense, what doesn't, and see what they can do to address issues. The goal is to look to other states maybe that are doing better in some areas and try to learn from them, and areas where Iowa's doing really well, maybe share that information with other states to try to help them get up there. Lift the boat all around.
Yeah, so these community leaders and policymakers, they really can improve the entire nation's health, but especially here if you get a hold of them in the state of Iowa. Is that correct?
Absolutely. Absolutely. That's the goal of this. Go to the report, look at it yourself, see what kind of interesting information you can get there, and then talk to your leaders about that and say, hey, I just noticed this. What can we do about this?
All right. Now, you said go to the report and look at the report. Where can we learn more about this? Where can we go take a peek at this?
americashealthrankings.org is a fantastic site. It has the full report. You can break it down to look at your state. And there's some things where they talk about social isolation. You can even break it down lower down into counties and things.
Oh, that is perfect. Yeah, so americashealthrankings.org/Iowa to get everything we need to know about here in the state of Iowa. Dr. Ravi Johar of United Healthcare of Iowa, thank you so much for your time.
It's a pleasure being with you. It's always fun.
Thank you, and thank you for watching, everybody.